Hello, everyone. Thank you for joining us. On behalf of the Office of Global Learning, the Graduate School, the Division of Student and Campus Life, and Cornell Health, I'd like to welcome you to this panel to address international students' concerns regarding well-being, health, and student and campus life considerations for the fall semester. My name is Gustavo Flores Macias. I'm on faculty in the Government Department and Associate Vice Provost for International Affairs. Our main objective for today is to try to answer as many questions as possible to provide some guidance regarding these concerns. Before we turn to our panelists, I would like to thank the International Student Union and the Graduate and Professional Students Assembly for bringing some of these issues to our attention, sharing questions for today's session, advertising the event, as well as those of you who submitted questions online when you registered for the panel, to attend the panel. We will begin by addressing these sets of questions before opening the floor for additional questions through the Q&A. As with previous sessions, I should note that there are some questions for which we may not have complete information yet. We will continue to post information on the Office of Global Learning's FAQ and other websites, and we'll share some of those with you today, where you can find additional information as soon as it becomes available. And finally, I would like to thank our panelists for joining us today. They and their teams continue to work full throttle to address the concerns of the international community, and I appreciate their taking time to be here this morning. So I'll let our panelists introduce themselves, starting with Jana.
Hello, good morning, everyone. My name is Jana LeMay. I'm the Assistant Dean for Student Life here at the Graduate School. I just also want to say thank you for attending the session today. I want to add that I often talk to graduate students about being resilient and the need to have that attribute to be able to complete your graduate degree. But I also want to acknowledge the magnitude of what we are experiencing as a community together. Your need to be resilient, to have grit and perseverance is at an all-time high right now, and you are doing it just by being here today. So thank you sincerely for taking the time and being with us this morning.
Thank you. Chris.
Hi, my name is Chris Payne. I'm the Director of Administrative Services at Cornell Health, and thank you very much for inviting me to the panel today. I look forward to answering some of your questions about quarantine, testing, and insurance.
Thank you, Chris. Elizabeth.
Hi, everyone. My name is Elizabeth Shedd. I'm a Senior Immigration Advisor at the Office of Global Learning.
Thank you. Wei.
Hi, my name is Wei Kwong Wong. I'm Assistant Director for Community-Based Services over at CAPS, Counseling and Psychological Services. And again, I just want to echo what other people are saying about the uncertainty of the current situation and how difficult it is. And we'll try to provide as much information as we can, knowing that there's still a lot of things that we're trying to figure out as we speak.
Thank you. Pat.
Good morning, everyone. My name is Pat Wynn. I'm Assistant Vice President in Student and Campus Life, and housing and dining fall into my purview, which is why I'm on this call to help guide you through some of those questions.
All right, thank you. So what we'll do, we'll start with some of the questions that have come in. If you could hold off on questions, the Q&A in the chat, we won't address those yet. So we'll turn to these questions that many of you submitted during the pre-registration process, and we'll start with those. So, you know, don't be surprised if for now we're just not calling on you, and then at the end of the session, we'll make sure we have some time for some of these questions that come in live through the Q&A. So we'll start with Chris, and I think we'll start with a set of questions that have to do with quarantining and the protocols maybe for international. And there are a series of questions. I will quickly just read a couple, but several have to do with this. You know, will international students be required to quarantine for 14 days on arrival? If you come from a country that does not exceed sort of New York State's limit of 10 positive cases per 100,000, do you still have to self-quarantine? Can I travel to New Jersey to see some friends before coming to Cornell? Do I need to quarantine? So, you know, could you speak to these issues, Chris?
Absolutely. Thank you, Gustavo. And thank you all for coming this morning. So as I answer many of these questions, I'm going to eventually start sharing my screen, and I'm going to try to orient everybody to some wonderful resources that are available online, both through Cornell and through other sites. You won't need to scurry to write down the websites. After I'm done speaking, I will post all of the links to the sites that I'm showing you in the chat. So as Gustavo said, we're going to start with talking about quarantine. So Cornell recommends first that all students get tested at home if they are able to, and after testing that they quarantine at home for 14 days prior to leaving to come to Ithaca. It's important to know that there is also a mandatory 14-day quarantine period in the United States and in New York State for all individuals arriving from all international locations. It's also important to know that New York State has additional restrictions and requirements for people coming from certain states in the United States. I'm going to show you in just a moment a list of those states. But if you're traveling in from a state that's on that list, you're also required to quarantine in New York State for 14 days. So for this reason, we're encouraging students to be very careful and cautious about their travel plans. Planning to travel into the United States, into a state other than New York State, and then stay there and travel from there to New York State could cause you to need to quarantine twice. So I'm going to now take a moment to share my screen and show you some really important resources. Okay. So the first resource I want to orient you to is Cornell's own COVID-19 and reactivation planning website. There is a wealth of information here on a variety of topics, which you can see down the left-hand side. Here in the information for section, you can find an information for students section, and then you can see a sub-site for international students, which I'm clicking on right now. There's a little bit of information here directly, and then this site also suggests that you visit the Office of Global Learning's website. The Office of Global Learning is putting up a FAQ for the international community. And here you'll find answers to many of your questions. So these are very important sites to be aware of, bookmark, and visit to see if the answers to your questions are there. Additionally, Student and Campus Life has created a website that provides guidance around quarantine for students who are arriving to Cornell. So this is another great site that provides some summary information to you and some links. Now I'm going to take you outside of Cornell's websites and take you to the CDC. So the CDC does have guidance, and this is where all of Cornell's guidance is coming from. So the CDC is the agency in the United States that sets the standards for quarantine requirements for people traveling from international locations into the United States. So these guidances can change over time. So it's important that you know what the quarantine requirements are at the time you're traveling. That's really what matters. Is if you're traveling next week, you need to know what the quarantine requirements are on that day that you're traveling. Finally, I'm taking you to the New York State website. This is, you recall earlier, I shared that within New York State, there are requirements for quarantine for people traveling from other states. So on this site, you can see all of the restricted states. So people traveling to New York who have stayed overnight in any of these states do need to quarantine for 14 days upon arrival. So it's important to know, just in closing around the quarantine question, that students are going to need to comply with all state and federal quarantine requirements and should be aware of those requirements at the time that they're traveling. So now I'm going to move on to the next set of questions, which was about testing, COVID testing. And I'm going to take you to another website. And this is Cornell Health's website. And on Cornell Health's website, we now have a brand new page that covers a lot of information about testing and quarantine. So you can follow the link right here about returning to campus. and it takes you to this lovely web page. And the first item on the page is about testing. And it really talks about testing in 3 different categories. And it's important to really understand these 3 categories. The first is arrival testing. This is done for all students who are coming back to the Ithaca region, regardless of where they're traveling from. And it's a requirement to returning to campus. It's done in collaboration with our local healthcare providers called Cayuga Healthcare System, or Cayuga Health System rather. And this testing is done at locations across campus. There is no charge for this testing, and it's a one-time test. You come, as you're arriving, you get your test, and then you've satisfied that arrival testing requirement. The second set of testing is what we refer to as ongoing surveillance testing. So this is on a regular basis, all members of the campus community who are coming to the Ithaca campus, coming onto the Ithaca campus, will need to satisfy regular testing requirements. This is not testing because you have symptoms. This is not testing because you've been exposed. This is testing for people who don't have symptoms, haven't had exposures, and it will be required on a regular basis for students. It'll be part of your daily check process where you'll get an alert that you need to satisfy a testing requirement. This is also provided through the university at locations across campus and is free. There are no charges associated with this testing. The final group of testing is called diagnostic testing. That's the testing that you will receive through Cornell Health. You receive this testing if you've developed symptoms, and our clinical providers need to evaluate you and determine, do you have a cold? Do you have the flu? Do you have an upper respiratory infection? Do you have COVID? So this process starts with a visit, typically a telehealth or a phone visit with one of our clinical providers. They'll work with you to assess whether or not you need the testing. It could be because you have symptoms, or it could be because you've had a known exposure to somebody who's been diagnosed with testing. Your clinical provider will help make the decision and order the test. Then you'll get the sample collected from Cornell Health, and we'll process that test and get the results to you. For this testing, we bill your insurance. Your insurance is required to, in the United States, your insurance is required to cover diagnostic COVID testing at 100%. So there will be no out-of-pocket costs for this testing as well, but we will bill your insurance.
Thank you, Chris.
Yeah.
So that you cover a lot of ground there. You cover a lot of questions that came in regarding, what if a student becomes infected with COVID? Will the school insurance package cover the medical expenses? There's a question here: how will the study away program affect the student health plan? Will it cover payments, medical visits in the host country?
Sure, that's a great question. Thank you. So, I just covered a lot about testing at Cornell. So, if a student needs care outside of Cornell Health's system, that's where their insurance definitely kicks in. So, if they need, for example, to go to the hospital, to go to the emergency room, or be hospitalized. If you have the student health plan covers all COVID-related care at 100%, and that mandate is currently in effect in New York State and in the United States through September. Even if that mandate is rescinded, the student health plan is very robust coverage and covers 90% of costs. And it's also your out-of-pocket costs for any care is limited to $3,000 in the coverage year. So it's very good coverage with very low out-of-pocket costs. But again, I want to emphasize that currently in the United States, insurances are required to cover COVID care at 100%. And that coverage extends to students regardless of where they're located. The student health plan actually covers worldwide at 90%.
Thank you, Chris. Let me ask you a question about waiving the student health plan. We have a few questions in that regard. Could international students waive the plan this fall semester if they're not going to live in the USA? And if so, how?
Thank you, Gustavo. I'm going to pause on answering that question and spend a little bit of time talking about Cornell Health Services and then answer the question. So it is important for students to understand that when students are located in the Ithaca region, Cornell Health is able to heavily supplement what their insurance covers, to the point that Cornell Health can be the primary provider of their medical and mental health care needs. When students are distant from Ithaca, but still in New York State, we can still heavily supplement their care through telehealth. But they need to start relying on their insurance more than they would if they were in the Ithaca region. So for example, we can't collect lab tests and process lab tests if a student is distant from Ithaca. We can't provide x-ray services. So the student starts to need to rely on their insurance much more if they're distant from Ithaca. Once students leave New York State, our ability to supplement their care through telehealth becomes very limited due to the regulations that govern interstate healthcare delivery in the United States. Once a student leaves the United States, our ability to provide healthcare is extremely limited due to international regulations. So while Cornell Health wishes it could provide supplemental services equitably to all students, regardless of where they're located, we simply can't due to these regulatory constraints. Students distant from Ithaca, particularly those outside of New York State, need to rely on their insurance and local healthcare providers for their healthcare needs primarily. This is why the university has a requirement that all students have health insurance that meets at least 60%, that meets our minimum requirements, which is at least 60% coverage where they are studying. Ultimately, it's each student's responsibility to make sure that they have insurance that they can afford. And when we talk about affordability, we want you to look not just at the premium, but also it's very important to look at the out-of-pocket costs at the time you're receiving care. These are things like co-payments, co-insurance, and deductibles. It's important to determine that you'll actually be able to afford care when you need it. So look very closely at your insurance product when you're making your decision. Our Office of Student Health Benefits is available to help you look at your options and think critically about them. So with all of that said, Gustavo, the answer to your question is that for students who are studying remotely from the Ithaca area, and this includes students studying in international locations, once Cornell Health has gotten validation of the student's location of study, which you're all entering in the return checklist or the incoming student checklist. Once we have confirmation of your location, and we expect to have this in the early August timeframe, our office will be proactively reaching out to you to let you know that you have the option to waive the student health plan. Again, if you're in an international location, as long as you have insurance that covers you in that location, we'll offer you the opportunity to waive. That waiver will only be in effect for as long as you're in that international location. If you return to the United States, we'll re-enroll you in the student health plan. So again, we're here for you. We're here to help you, and Wei is going to talk a little bit about those ways that we're still here for you, even if you're in a distant location. And we encourage you to make an informed decision about your insurance choice. Thank you very much.
Thank you, Chris. All right, well, I think now we'll turn to Wei. And Wei, the first question for you is, considering the lack of group counseling availability across country lines, how is Cornell Health planning to fully meet the counseling needs of international students to whom the university owes adequate healthcare?
And again, I think that's a really challenging question, and I think it's an excellent one. As Chris said, I mean, I think some of our options are more limited for international students who are abroad, due to these international regulations. And so there's certain things that we legally cannot provide, unfortunately, as much as we would like to. So we can't provide, like I think the questioner said, we can't provide things like remote counseling or anything like that to students outside the United States. And actually to a lot of the states within the United States, we can't do that either. Depends from state to state. What we can provide is consultation, referrals, and workshops. And I think there was a later question that asked exactly what does that mean? Fair enough, So while we can't do any kind of ongoing counseling, we can provide consultation. So what that basically means is that we can have a conversation about a student, no matter where they are, about their problem or concern, or sometimes just a question. And then we can brainstorm with them about a plan or some course of action. And maybe we can review with them what their options are depending on their situation. So it's not ideal, but I think, sometimes the student might benefit from just a conversation to help them sort of like think about the problem and help maybe clarify their thoughts, or maybe look at some of their options in that way. So we have a couple of programs specifically for that. One of them is Let's Talk. And I can, I can try to share. I don't know if that's. So Let's Talk is a program that we designed many years ago for students who are maybe not sure about counseling, or maybe they have a question about counseling that they're not sure that they actually want to make an appointment for. And so normally Let's Talk is a program where we have counselors located at different locations on campus, and the students could sort of drop by without an appointment, first come, first serve, and basically just talk to a counselor and say, here's my situation, what do you think? And it's good for a person who may want a professional opinion about something. Students oftentimes come in and go, I'm not even sure if this is a big issue or not. Students come in and go, I don't know what to make of this. Sometimes students go, I do have a problem, what are my options? I mean, whatever it is. So under current circumstances, we've moved it online. So we have what we're calling like Let's Teletalk, where we're basically having a free drop-in Zoom session. So a couple of hours in the fall will be every single day during the week. There'll be a counselor available, first come, first serve, for any student who just wants to talk to them. And so if you have a question, if you're not sure, if you're wondering about what kind of service, if you're wondering if counseling is appropriate for you, I think that'd be a service you can sort of drop by and just talk to a counselor for free. Again, no appointment necessary. Whoever shows up first gets seen. And so that's available to anyone anywhere in the world. In addition to that, we also have 24-hour phone consultations with a counselor for more urgent situations that you can do by telephone. We also have workshops. So workshops are more educational in nature. So we have workshops on procrastination, on stress management, on coping with anxiety and things like that. And workshops are available to any student. So I think these are oftentimes very useful as well, because they will teach you specific skills that you can sort of take home with you and hopefully practice and hopefully, help you, deal with whatever it is that you're struggling to deal with. If you're struggling with procrastination, we have a workshop for that in the fall. And so you can go to a workshop and maybe learn a thing or two about that and go home and try to put into practice and see how that goes. And so let me see if I can share or not. Hold on a second. I've been doing this for 3 months. I'm still lousy at Zoom. Probably take me longer to find that page than to actually talk to you about it. But we have a page for workshops, and again, they're online as well. And we'll be putting up a full schedule for the fall soon. And again, I think you just need to register with them, and you can drop by anytime and go to as many of them as you like, as often as you like. And we also have referrals. So again, as Chris said, that we can't provide services for you at Cornell Health necessarily because of your location, but we can maybe help you find those services. So, if you contact us and saying, and we talk to you and say, maybe counseling is something that might be the best option for you. Depending on where you are, maybe we can help you sort of look at your local options, maybe coordinate with insurance and things like that, and try to connect you with those services in your area so you can get what you need. So again, I recognize that these aren't ideal, but these are the things that we have for now. And in addition, Cornell Health is actively looking at some other options, which, and again, I think the situation changes from day to day, from hour to hour. But we're also looking at some additional options, which I don't know if they'll pan out or not. But hopefully, we do recognize that a significant number of students may not have the ready access to services that students who are here at Ithaca may have, and we're doing our best to try to bridge that gap. But know that you're not alone out there. We are here to help you to the best of our ability through Let's Talk, to workshops, to referrals, to consultations. And so hopefully, if you do encounter any difficulties, that you can feel free to contact us, and we can help you brainstorm and hopefully make a plan to get your needs met. So I don't know if those are the most satisfying answers, but again, I hate to use the word unprecedented because it's used so often. I'm sick of hearing it, but the situation is unprecedented, and I think we've been working furiously to try to figure things out as we go on, because none of us have ever been in this situation before. And hopefully we will sort of like come up with a workable solution to meet the needs of the students no matter where they are. Because like you said, you guys do deserve, to have your needs met, to have counseling services and things like that. And again, I think we're doing our best to try to come up with a plan where you can get that.
Thank you, Wei. I know that Jana also has something to say about workshops. Just before I turn it over to Jana, could you just clarify? I know that there's some confusion among students about the online secure messaging system. And there was an understanding perhaps among some that you could only call, that you had to make a phone call, but you can do this online through a secure portal. Is that correct?
Yeah, I believe so. And again, I think, if you want to make an appointment or something like that, or things like that, I think you can do that through the secure portal as well. I think phone is easier sometimes, but I know depending on time differences, that can be a challenge, just because then you can get somebody on the phone and they can actually schedule something for you. But again, I think if because of time differences, it'd be easier for you to do through the portal. I think that's an option if you want to try to contact us and you want to request a service.
Thank you. Okay, Jana, if you could share maybe some thoughts on the resources for graduate and professional students as well regarding workshops.
Thank you very much. Before I answer, I just want to make it clear that I'm representing the graduate school, and so this is for graduate students. I also will say that there are professional schools out there, so there's law, vet, and business, and they each have their own units and are offering a slew of opportunities as well. But I'm going to answer this as far as for graduate students only. And so I just want to note, in addition to what Wei is offering through Cornell Health, that the graduate school remains committed to providing some programming support, some workshops that are available. We do that through our professional development framework, which is called Pathways to Success. And we also do this primarily through our big Red Barn Graduate and Professional Student Center. And so you'll see topics remotely offered through the fall semester, so you can be anywhere to access that. And that's purposeful to recognize that not all of our students are going to be here at Ithaca. And we're going to be talking about things like transitioning to graduate school, leadership development, resilience and balance, and what does that all mean, along with some social opportunities via online, to be able to help connect students with an interdisciplinary campus that we have of graduate students. And so in addition, I'll just highlight that a lot of our graduate fields are doing a lot of creativity and providing some opportunities for our students to be able to connect with one another. So locally you can get that support, but in addition, you can get that support through the graduate school as well. So I just wanted to put a plug into that as well. Thank you.
Thank you, Jana. We have some questions now that have to do with the student and campus life. So I'll turn to Pat for these. The first one, and there are a few that are related, but just generally, when should international students plan to arrive in Ithaca such that Cornell is ready to receive the students?
Yeah, there are actually several questions around this topic, so I'm going to kind of speak to a broader range of these questions all at once. So if you're living in off-campus housing, you should plan to arrive in Ithaca at least 2 weeks prior to the start of classes, which start on September the 2nd. And again, this is so that you can be in compliance with the New York State mandate that all students coming to New York from outside the United States must quarantine for 14 days upon arrival. It is vitally important that all international students, including those from Canada, adhere very strictly to the quarantine guidelines as they exist. If you're an international student that is planning on living on campus, we will instruct you as to when and where to report for check-in and testing. So it's two very separate tracks. The date that we provide for check-in and testing will allow you to complete the full quarantine before the start of classes as outlined by New York State. It's also important to know that after testing, if you are living on campus, you will be sent to a facility for quarantine that we are basically making all of the arrangements for. If you're living off campus, you will need to quarantine in your apartment or residence or room, wherever it is you're living. It's very important that you understand the difference. So if you are off campus, you'll be asked to quarantine in your residence. And it's also important to note that your quarantine will begin when the last student arrives in your apartment. So if you have 3 roommates and one comes on Monday, one comes on Tuesday, and one comes on Wednesday, quarantine starts on Wednesday for everyone. It's also important to know that if a student tests positive who lives off campus, they will fall under the jurisdiction of the Tompkins County Health Department and will need to follow their rules for isolation. Your quarantine or isolation location will be determined by them and not by Cornell or Cornell Health. One other thing to consider is that if you are living off campus and you need to change your living arrangements, you'll need to work directly with your landlord. Cornell cannot get involved in this because that is a contract between you and your landlord. So just something to think about if you're planning on making some changes. We are also strongly discouraging parents from traveling to Ithaca with their student. Those that choose to accompany their student must register their travel arrangements with New York State, and they must be tested. So if you choose to stay for less than 14 days and you're coming in with your student, you will need to quarantine for that amount of time. If you are coming, you'll need to work with the Cayuga Health System to make the arrangements for your testing. And we want to stress again that it is vitally important for all students and their parents, if they're coming, to abide by the quarantine rules and regulations. Just as a note, if you're living on campus, we are not permitting any students or guardians or relatives to enter our buildings. So if you are coming, you will be, and living on campus, you will be told where to report for your testing. You will be told where to report for your quarantine for the time that the tests are being monitored. And then you will move yourself into your pre-assigned room. So it's just very important to know that. And lastly, everyone received the re-entry checklist that was sent on Friday, July 17th. If you haven't received that, please let us know. It is vitally important that you complete that checklist, and this is for all students. The deadline to complete that is Sunday, July 26th. Again, if you're living on campus, we will tell you when and where to arrive in Ithaca and where to be tested prior to quarantine. So I think that covers most of the questions, but I can take additional questions if there are some.
Thank you, Pat. Maybe one that I know spans across units is one that has to do with pre-orientation programs. Will there be any pre-orientation programs?
Yes.
Pat, go ahead.
Yeah, thank you. I should have mentioned that. Our team is really working hard to create a slew of orientation, social, and informational programming for all students to better acquaint you with our campus, to get to know each other, and to keep you as engaged as possible during the quarantine process. If you are in quarantine for 14 days, as many of you will be, we are looking for volunteers to actually be calling you on a regular basis to see how you're doing, ask you how you're feeling, ask you if you need anything. So that's a pretty big project that we're working on, just so you have that personal contact with someone here at Cornell who can guide you through any questions or concerns that you have. But yes, there will be some very robust orientation programming.
Thank you. Jana, would you like to share some thoughts as well?
Sure. The graduate school is also working on a slew of programming for our incoming graduate and professional students as well. And so with the same goal, we want to make sure that our incoming students are able to transition to Cornell. It is all online, and with the idea that we want to make sure that all students are able to participate and gain the information. We will be sending out an email to our incoming graduate and professional students the first week of August, excuse me, and that will have details as far as how to access us. But absolutely, we want to make sure that this transition, you have all that you need so that you can be successful, realizing that there's a lot of other things going on right now. So, and I know, Elizabeth, you have something more to add?
We do, yeah. So we have the Prepare Pre-Orientation Program for the undergrads, and that's going to be starting in the week of August the 17th. And then on the 29th, we'll be having the grad and professional orientation, and that's for all the upper level and transfer grad students. For both of these events, if any of the continuing students who are listening right now would like to volunteer, it would be great to have your voices. We're going to need input from students on what it is to be a Cornell student, how to interact with a TA, how to navigate physically the Cornell campus. We'll cover a lot of issues. And really our volunteer team is what makes these orientation programs so great. So if you're interested, just reach out. Our email address is international@cornell.edu.
Thank you, Elizabeth. So I'll turn now the next few questions to Jana. They have to do with the graduate school. And the first question is, international TAs are under a lot of pressure to teach in person right now due to fear of losing their full-time status and/or funding. Could you clarify whether the graduate school's TA policy still stands, given that multiple fields have now rejected this policy in favor of their own?
Yeah, I'm happy to answer this. And I just want to acknowledge that, yes, I'm sure that this is a concern. We know that this is a concern for many of our TAs. And so what I can offer you is just an understanding of the process to go through so that you know how we're viewing this and then how you can insert or figure out, what options exist to you. So first and foremost, decisions about pedagogy and curriculum, including the mode of instruction, is really up to the faculty and the individual department. And so that's where this is going to begin. We're asking all TAs to check in with your TA supervisor to determine, what the department has said as far as the teaching modality for the course that you are assigned to. And with that, you might be able to ask for some flexibility in that TA assignment to make your choice. If there's a mix match as far as that you want to do online, let's say, and the course is in person, then we do have a method of what you can do as far as to be able to sort this out. First, I want to note that if there's a personal health concern related, we have teamed with, and I shouldn't say we teamed with, Student Disability Services has always existed on its own, but we're encouraging students to go through Student Disability Services to get some extra support and having those conversations to be able to mitigate any barriers to allowing you to TA, or perhaps to reassign you another TA that may be online or not in person. So know that that's a resource for folks there. If the concern's not related to your health, what we would do is we would suggest that you go right to your TA supervisor about your needs and your concerns. And if that doesn't feel like it's being met, then I'm going to tell you to escalate it appropriately. And so you can include your director of graduate studies, your department chair, the college's dean's office, or even the graduate school. And so, our intention is to be as flexible as possible for individual TAs to be able to TA in the mode that they can, but understanding that the modality of how each course is being taught is really determined by the faculty and the department and the educational needs as a priority. So, you know, I leave you with knowing that that escalation path exists. And if you wanted to talk about that, you know, before you make it, you know, escalate it, please come to me. We're happy at the graduate school just to consult with and to talk about your concerns and, you know, to see if there's any other, you know, the value to using student disability services or coming or going through this other method, we can talk. So please don't suffer in silence and reach out to us so that we can figure out what works best for you on that. So.
Thank you, Jana. Here's another question. If one arrives on campus later in the semester, would she or he be able to switch to the on-campus version of classes?
So we've heard this a few times, and especially from our international community. And the short answer is unfortunately no, okay? And so spaces available for in-person classes on campus will be very limited. And it's really just to allow physical distancing so we can make sure that we have a safe environment. When you enroll for your classes, you'll enroll in one modality or another. So you'll have to choose between remote, in-person, or in-person, excuse me. The nuance that you should be aware of is that if you choose to be in person and let's say that you become ill, there should be a remote option for you. And so that if you can't come to the in-person class, there will be something available to you. It's a little different, but the flip of this as far as that, you know, if you're in person and you become sick, then you should be able to access the course material remotely. But unfortunately, if you decide to come to Ithaca in the middle of the semester and you've signed up for a remote class and you want to take it in person, that's not going to be allowable. So to know that you can't switch in mid-semester.
Thank you, Jana. I have a few questions now for Elizabeth that have to do with immigration. And, you know, let me start. The first one asks, can international students take more than 3 credits online? And how will you ensure that we have space in the in-person classes so that we are allowed to return to campus?
Yeah, so good question. There are 2 parts. So the answer to the first one depends on the student's status. So are they here already? Are they continuing in their program? If they're here in Ithaca, they can take more than 1 online class. And so for the vast majority of our students, the answer is going to be yes. If you think that you are an exception to that, what I'm going to ask is that you check the FAQ section, because all of this is going to have the most up-to-date regulations as interpreted for Cornell for incoming students, so students who are just starting their program, and for continuing students. So we separate the answers out depending on that. For the second question, the answer is that we're working field by field to ensure that students have enough coursework to get through their programs.
Thank you. The next question is, what happens if international students need to leave the US to take care of their families? Can Cornell make arrangements to provide a stipend support during this time of need?
Yeah, so the first part of that question, I think, is very similar to the students who might feel unsafe during the pandemic, or the COVID-19 situation gets worse and they might want to go home. And you are certainly not tethered to the United States. If you need to go home for whatever reason, absolutely, you can leave. So the question remains, like, is there going to be an impact on your immigration record? Depends on when you would leave, if you're able to maintain your coursework from abroad. So those are question marks, and I guess they would be on a case-by-case basis. But don't ever feel like you would need to stay in the United States if you need to leave and go home and take care of family, or you just would feel safer in your home country.
Thank you. You know, we have a couple that are very specific, but perhaps I'll ask a more general one that asks, when will we get new I-20s?
Yes, so I guess it depends on what the motivation behind this question is. So, you know, a couple weeks ago, everyone thought that they needed new I-20s to denote the hybrid nature of the fall semester. But that was revoked, so you shouldn't need that if you're a continuing student. If you are an incoming student, reach out to us from the email address that we said before. There's a chance that you might need the denotation, but we would need to look at your personal situation, like if you're incoming or a transfer student, if you're here in the United States versus abroad. But in general, continuing students who are in the United States will not need this denotation on their I-20. But if you're worried about simply getting a new I-20 that has a new travel signature on it, you can get that the normal way that you always have. So you submit a request via our website and we'll mail it to you wherever you are.
Thank you, Elizabeth. So I will turn to some of the questions from a Q&A that are coming in. Some came in during the first half of our discussion and overlap quite a bit with some of the information that we've covered. But I think this question might be for Elizabeth. I see a question from Terry that says, I would like to address the eligibility requirement stating that a travel restriction is making it impossible to travel back to Ithaca. It feels extremely imperative to me to address this, as I know that it is creating a lot of panic among international grad students. Please remove this requirement. This creates a lot of uncertainty as these are changing very often and rapidly. This is something that does not have to do with a graduate student's personal circumstances in terms of the quality of the work and research that they provide at Cornell. Given the fact that many of us have already made arrangements in our home countries or somewhere closer to home in terms of calling on people and resources, there to be able to live and do work at current locations, and that arrangements have already been made in terms of subletting apartments, etc. Cornell cannot expect us to suddenly drop all of this, especially in the more financially precarious situations that international grad students are in right now. So it's a complex question. I think there's an immigration component there, but anybody should feel free to give it a shot.
Yeah, definitely a great question and very well stated. So thank you very much. It was something that's very necessary for us to bring up. I don't know if we can merit a good response right now. It sounds like something that's multi-layered. But if I'm understanding correctly, this person is referring to restrictions on the Schengen area. And I'm putting in the chat box just the most recent information that we have on those restrictions. So I know it's not a completely satisfying answer, but it's ongoing, and we're formulating something that will work for the rest of our community as fast as we can.
Thank you. Jana.
Can I offer as far as that, we have a lot of students that are not in Ithaca or are overseas and trying to figure out what to do. And we've encouraged our faculty to be really flexible with their students as far as, if the research that is being done really requires them to be on campus or here. And so I can't tell by the nuances of the question, but, I think that, in addition to finding out about immigration and travel restrictions, absolutely, it may be also helpful to explore, what are the expectations of the research that's going on, and what does the fall semester look like. And so we have been able to talk to various students and faculty to try to come up with some creative solutions in situations where it really isn't about choice, but that there are some restrictions placed upon the student. Fundamentally, the question I think would be is, what research are you doing, and is there enough that you can do from a distance, and I can't tell by this email, but if one doesn't need to be in the lab, perhaps, or can there be a shift in what it is that you're studying, there may be some flexibilities there that, folks would be able to work with you. So I would encourage you to reach out to myself or anybody at the graduate school, and Elizabeth, as far as finding out more about immigration. We work together a lot, but there may be some other things that we can explore that would allow you to still make academic progress from where you're at. And that's just the other path that I wanted to highlight here.
Thank you, Jana. Here's another question that has to do with immigration. Does resuming mid-semester this fall affect our eligibility for OPTs?
I think the question I would have for that student is, have they met the minimum eligibility to begin with? So I'm assuming if they're here and they're asking this question, they've already been enrolled for at least 2 semesters in a row. And so if they have an active CVIS program and they are within the United States, they can apply for OPT. It's not possible to apply for OPT from abroad. You have to be within the US if you're going to ask for a benefit of your F1 status. So the answer can vary depending on individual circumstances, but in general, if someone is here and their record is active, then yes, they can apply for OPT.
Thank you. I have a question that has to do with housing. And Shravasti asks, will the 14-day quarantine for international students staying in on-campus housing cost extra in addition to housing fees?
No, there will not be an additional charge. If you are living with us, we are making arrangements to either keep you in one of our own buildings or to place you in quarantine in a local hotel, and we are bearing the costs of that.
Thank you. Here's a question about Cornell Health. Rawan asks, what should I expect after submitting a waiver application through Cornell Health email since my checklist hasn't been updated?
I think that may be somebody who's referring to what I talked about earlier in terms of once we've validated location, study location, we'll reach out to students. So that completion of the checklist is critical because that is our official record of your study location, and that will drive many policies across the institution. So we really can't take any, if we've received an email from you, we've got you in our line of sight, but we do need that confirmation of your study location before we can do anything else.
Thank you, Chris. Here's a question. We've alluded to this in some form, but I think it's worth maybe reiterating. Amol asks, what are the isolation resources or accommodations available to off-campus students in Ithaca that may not be confident in their existing accommodation to be adequately safe for cases where they or a cohabitant tests positive? What is the capacity of such resources and what are the contingencies?
So,
you know, anyone in this situation would be subject to Tompkins County Health Department determining if their living situation was adequate or not. So that's really the first step. And then Chris, do you have anything to add?
Sure, I'll say that your Cornell Health so if you are symptomatic or if you've had an exposure that causes us to need to do diagnostic testing, you'll be working with a Cornell Health provider, and our Cornell Health provider and our amazing nursing staff will work very closely with you and with the Tompkins County Health Department to determine what the appropriate isolation accommodations are.
Thank you. And here's another question that has to do with maybe the relationship between testing at Cornell and testing by the New York State authorities or Tompkins County. It says, I'm an incoming grad student who will be receiving the Cornell student health insurance from my department funding. I am trying to register for the mandatory arrival testing currently in New York, but getting this message from the Cayuga Health portal, quote, your testing will not be covered by insurance and the organization you have identified does not have a payment arrangement established. You will be required to pay by cash or credit card at the time of service. Should I still proceed?
I think I can help here, and I'm going to share my screen in order to do that. So give me just one moment. All right, so I'm taking you back to a website that I already showed you, which is Cornell's COVID and Reactivation Planning website. Within that website, there's a health and safety section and testing within there. There is a link here, and you'll also have this link through the checklist. If you're going through the links that we're providing you to schedule your testing, your arrival testing, then it skips several sections of the Cayuga Health Systems registration process. So if you go through those links, the Cayuga Health Systems system knows that you're a Cornell student scheduling your arrival testing. So that's the preferred way for you to do this. If, however, you've entered through one of Cayuga Health Systems links or another link, it's really important that you identify who you are correctly. So you would have to say that I'm an employee, contractor, student, or visitor. So that tells them sort of what basic category you're in. You have to then select next, and you have to do this organization search, and you can scroll down until you find Cornell student. If you do all of that, the system should know who you are and handle you appropriately. It will still ask you for insurance information. That's standard in the Cayuga Health Systems system. It's not mandatory that you put in your insurance information, and you will not be asked for an insurance card when you come to the on-campus testing sites. I hope that helps.
Thank you, Chris. We only have a couple of minutes left, so maybe I'll just mention a couple more questions quickly. One is, can students and parents quarantine in Ithaca hotels?
Yes. The amount of hotel rooms right now is very limited because we have actually contracted with almost every hotel in Tompkins County to provide the initial quarantine necessary for students moving on campus. We have a very detailed plan for moving students on campus, and that requires that students are tested and then in cohorts of 800 are placed in local hotels to await the results. We will also be placing students in hotels outside of Tompkins County as we need the additional beds. Again, parents should really think about coming because they will be subject to the same restrictions and will need to be tested. So it's really something to think about before you make that decision.
Thank you, Pat. Another is, there are no flights to the US from my country on the 17th. Can I arrive in Ithaca on, say, the 15th or the 18th?
Yes, it would be better if you arrive early than later. So, and we are encouraging students to do that.
Okay, and perhaps the last question I'll mention, it has to do with the order of testing and quarantining. It says, so international students can arrange for their testing only after their mandatory 14-day quarantine. So if you could clarify, does one arrive, get tested first and then quarantine, or does one quarantine and then get tested?
For students living on campus, we will be giving you the day to arrive and the time to arrive, and you will be directed in this piece of information where to go for your test. For students who are living off campus, it will be a similar process, but the logistics are different. So Chris, do you want to jump in?
Sure, and Pat, I think that's really critical. And the logistics are going to be different for every person because it depends on your unique situation. So if you are in quarantine after arriving in the United States and living off campus, you really should contact Cornell Health for guidance on how your arrival testing should occur. We really want to be very careful to make sure that folks who, for example, might arrive and be symptomatic get tested the right way in the right location. So please reach out to us and we'll help you figure out the right approach for you.
Thank you. Well, we're out of time now. I know that some questions have gone unanswered, and students will probably have many more after this panel or in the coming days. I would just urge everyone to please keep consulting the FAQs from the different units. I know that every unit links to the others so that there's, it's not everything in one website because it would be just way too much information. But, the Cornell Health links to global learning and the other way around, and student campus life. And please, continue to get in touch if there's anything that you still haven't found the FAQ, and we're updating this regularly. Some of the questions that we still don't have answers for, we continue to work on. And I know that it can be frustrating and especially stressful given the lack of information and given everything that is going on in terms of, changing guidelines from the US government in terms of international students and when they can travel, when they cannot. So we understand this, and we're actively working toward finding solutions within the legal constraints that we're facing. So I will just end by thanking all of our panelists. I really appreciate your being here today and taking the time. And I'm sure we'll continue to, stay in touch with students and try to find answers and help them. So thank you so much. Thank you all for joining us.